In this video, I'm going to tell you all about frozen shoulder. This is a very common condition that affects males and females equally, usually in their 40s, 50s and 60s. The shoulder is a ball and socket joint, and outside that there's lots of layers of stuff that hold it together and move it around: skin, fat, muscles, ligaments and tendons. In frozen shoulder, those are all normal, but it's the deepest layer called the capsule, which is normally like a lycra balloon and allows the shoulder this amazing range of movement, that gets upset by something. Sometimes it's clear what's caused it, very often it isn't. But that balloon starts to tighten up and tighten up and tighten up and ends up like a tennis ball. So progressively the shoulder gets stiffer and stiffer and you lose movement week by week. It's very painful, particularly when you try to exercise or use it. And although it does get better by itself, that can take 18 months to 2 years. Things that don't really help with frozen shoulder are physiotherapy and standard steroid injections. So what does help? What can stop the shoulder freezing up? Well, if we see you early enough, there's a special injection we can do to inject water into that balloon while it's still got some elasticity and try and get it blown back up again to normal. That's called a hydrodistension injection and can be very effective. However, it doesn't work for everybody. And if it doesn't work, then what you should do, bizarrely, is let the shoulder freeze up as quickly as possible without any intervention, because the quicker it freezes up, the quicker it's going to defrost. Or, once fully frozen, if you're fed up with having an arm that might only go to here and is limiting your job, your activities, your hobbies and affecting your sleep, then there is an operation that will accelerate your recovery. That's called an arthroscopic capsular release. It's done as a day case operation under a general anaesthetic, so you're in and out of hospital in the same day. So it's done through 2 little holes, one at the front and one at the back. And what I do is look inside the shoulder, and that balloon that we talked about that's ended up like a tennis ball, well, I've got a special device that cuts that all the way around, freeing the shoulder up. And when you wake up, your arm is up over your head in a place it hasn't been for maybe a year or longer. You go home that day in the sling and you start your exercises straight away. It might sound a bit contradictory to say get on with it straight away after an operation, because often you've been told with surgery, be a little bit careful, don't do too much, let it sort itself out. But in this particular case, the quicker you get the shoulder moving, the quicker you're going to get back to normal. All operations do carry risks, but they're few and far between. The main risk is of the shoulder freezing up again, and that can happen if you operate on it too soon, before it's in this nice, calm, mature, fully frozen phase. It does happen, it's demoralizing, but it's rare. Another complication that's extremely rare is nerve damage to the shoulder, which could leave you worse off than you started. In 25 plus years of doing this, that's only happened twice, so it's an extremely unusual complication, and really, although it's there, don't worry about it too much. In summary, a frozen shoulder is when something upsets this capsule, the ball in the middle of the shoulder, and causes it to tighten up week by week, resulting in a stiff, painful shoulder. It will get better by itself, but that can take an awfully long time and have a big effect on your life, your job, your hobbies and your sports. And if you want to accelerate your recovery, then the arthroscopic capsular release is a very good way of getting you back to normal much more quickly than Mother Nature can.